Wow. Or plenty, I have to say. But if I have to choose one, that would be a smile on the face of each and every patient. And I think I will remember all the patients' names when we just go through response assessment and we see that there is an improvement. That's something that will stay with me forever. Yeah. Professionally, I believe the fact that the chance that I was given to take part in all of these amazing clinical trials will help me think outside the box and always have hope and faith that there is something else that I can do for my patients, and will help me look more proactively to treatment options, just to see how people can think about the disease and the treatment, and how to plan for what might happen in the future, for what to do when there is a progression, when there is a relapse. And it's a beautiful journey to see how can you tackle it. Something that I will definitely use in the future. The Intercept project that we have just started with Dr. Grove, it's an international platform for MRD monitoring. That's something that will change the standard of care, that will change our attitude towards treating AML. It basically helps us maintain complete remission. And right now we do have tools to monitor minimal residual disease, but we cannot act on it. But that trial might change it. And I think that's huge, and that will change our way of treating, both in terms of clinical research and publications. Being a part of ALLG and HSANS was a huge thing. It allowed me taking part in one of the publications and just interacting and in changing our information and experience was really, really amazing, and then mind-opening, I would say, getting into conclusions based on starting from the scratches and getting conclusions throughout the process of collecting data. Well, quite a few. It's the same as with the good moments. There were many, many challenges. Most of them, they were related to clinical decisions. Sometimes we had to decide on when to stop the treatment, when not to pursue further medications, and that sometimes was pretty hard. But at the most difficult moments, I would say I would always ask myself, what would Caroline or what would Chan do in that situation? Which also makes me realize like how significant they are in my life, in my professional and even personal life, how much of an impact they had. Well, my only one and only advice would be go for it. Go ahead and try it. It's an amazing experience and you will be supported. So just go for it. Yeah, definitely would like to give thanks to my patients. Two of the patients that I have taken care of were first patients in the world receiving new medications. So that's a huge trust that I was given. So I would like to thank them. And to blood cancer research for giving me this opportunity, and for my mentors for they support the patients with me, and their guidance throughout this year. It was an amazing adventure, and it will stay with me forever.